I'm talking today to Ben Bellows, who is Research Associate with the Population Council in Kenya. Ben, what's the problem with maternal mortality in Kenya?
Well, it's both an issue of magnitude and one of maldistribution. With maternal mortality, the size in Kenya is absolutely quite large. It's over 400 deaths per 100,000 live births, compared to most OECD countries, which register in the range of 1 to 10 deaths per 100,000 live births. So the inequality globally is quite striking. But also within Kenya, the inequality is also quite wide. There's a big gap between the high income and the high wealth quintile and the lowest wealth quintiles in country, and suggests that there are barriers to care that are somehow associated with or correlated with economic status.
And so what approach has been adopted to try and tackle this problem?
Well, recognizing that the problem exists on an economic continuum suggests that the solution might be found there as well. And so one approach that's been tried over the last several years is the use of a targeted economic subsidy. In this case, it's a paper voucher, but one could imagine a number of different related solutions that are providing a subsidy, a certain amount of money in this case, for a package of services that would significantly reduce the risk of maternal mortality to the targeted population.
So the mother can take this paper script to a rural clinic and get treatment
That's right.
as a result.
That's right. In this particular program, the current setup allows for mothers in selected counties who meet the terms of the program. It's kind of a means tested or a proxy means tested screening criteria. Allows that mother to take that voucher to a facility of her choice at contracted facilities in that area. And so it is still a pilot, and it is implemented in currently 5 counties in Kenya, in a country with 47 counties.
So how many women in those counties benefit?
Roughly 5 to 15%, typically in the lowest, intentionally, the lowest economic quintile. And they are then entitled to take that to a facility of their choice, both public and private sector, where they're treated according to a certain set of standards set by the Ministry of Health.
And what has been the impact? What research has been done that shows whether it's being successful or not?
Well, the Population Council has been working with the implementation partners, both the Ministry of Health, PricewaterhouseCoopers, and others involved in the program to evaluate it. And we're finding that the program's achieved a significant net increase in utilization. So we're finding not only that we're finding that there's a significant increase in the total number of users. So some women who would have gone in the absence of the voucher may in fact be getting the voucher, which isn't the intent. But that the bulk of the users are coming from what we might call new users or newly exposed to the health system. Women who in the absence of the voucher wouldn't have gone to seek care, wouldn't have sought care, wouldn't have had the means to seek care.
And whose babies might have died as a result of it.
Very likely.
Yes.
Higher risk anyway.
And so, as a percentage increase, is there a figure you could point to that would say?
We're looking at around a 10 to 15% increase.
Okay.